Dr. Robert Cohen. Today we're going to do a little bit of TMJ. I want you to meet Carla. She's in our research department, a wonderful, beautiful young lady. And she came complaining about temporomandibular joint syndrome. Carla, why don't you tell us what you feel? Tell us about it.
Yeah, so I always feel like really tense and tight in the jaw area, and like I grind my teeth at night, and like it can get more intense like if I'm more stressed out. And then the next day I'll wake up like really sore. Sometimes I get headaches as well, but mainly I always feel like sore in my jaw, and like it feels sometimes like tender to like chew like hard bread or something as well.
Okay.
So
Do you ever get headaches from it sometimes?
yeah, I do. If I like am really stressed out and I'm grinding my teeth a lot, then yeah.
Parent, on the back teeth and the back molars, more on the right side than it is on the left side. Not so bad, but it is some evidence of bruxism or grinding the teeth at night. So we're just going to isolate the masseter muscle. Bite down, relax, and we're going to inject. Another thing that is quite good, a lot of my female patients like it, is bite down, relax. If the masseter muscle is hypertrophied like Carla's is, it has no gap between the zygomatic arch and the lower angle of the jawbone. So when you soften the masseter muscle and you get it to shrink, it's called jaw thinning. And it will, by the very nature of it being contiguous with the zygomatic arch, the cheekbone, and the jawbone, this brings us in, so it gives more definition to the cheekbone and more definition to the jawbone. And a lot of my female patients like it. Rather than put a filler here or filler here, I always tell them, let's do this first. And by doing this, we might not need to use the filler on you at all. So we're going primarily for Carla, for bite down. We're going primarily to do the TMJ versus that. We're going to do a conservative dose. We're doing 20 units on each side. And then we will follow up with Carla in about 7 to 10 days and see if there's any change. And at that point, we'll decide whether we need to use more or we just follow her out again for another 2 months. I always tell my patients it's a 3-month type of treatment. Bite down, relax. As you remember when Carla was interviewed, she said that it increases with stress. Stress has a lot to do with it, and it's my belief that when you have stress, you shallow breathe. When you shallow breathe, you build up carbon dioxide, which leads to lactic acid, which leads to cortisol being released. So what I also like to give my patients is something to help take away the stress. Now, Carla, do you do any meditation, yoga, tai chi, or anything?
Mm-mm.
So there's a 3-minute breathing exercise I give my patients. 3 minutes in the morning, 3 minutes at night. It just teaches you to breathe. And when you do this after a couple of weeks, most of my patients have been doing it for many years, tell me that, oh, it really helps. So when you're breathing, when you're stressed, rather than default to hold your breath, if your body can be trained to breathe more, we can remove that component of the TMJ. Anyway, this is Dr. Robert Cohen here at Westside Aesthetics with TMJ and my beautiful assistant Carla here, and we'll revisit this in a couple of weeks.